I started my journey as a nurse back in October 1993 and have gained invaluable experience since then. I've predominantly worked in medicine and as a clinical nurse manager in infection control. I'd always wished to pursue a career in nursing, feeling the need to help and care for people, to listen and support and treat them in a compassionate manner. I wish to acknowledge, as in any job, there have been many challenging days and overall rewarding and fulfilling times. I've never regretted my chosen career. As a nurse, I feel our first encounter or interaction with a patient carves their experience. They've presented to the hospital for treatment. They're often anxious, worried, and maybe somewhat misinformed. They've left behind their loved ones, their dog or their cat, and the safety of what they call home. They do not wish to be a burden and want things to return to normal as soon as possible. They enter the hospital, this place, they trust their safety in our care, people they've never met before. My own personal journey began back in January 2014 as a patient. As well as being a nurse, I'm a wife, a mother, a daughter, a sister, and a friend. I was working full-time and had 3 children at home, and life was very busy. As a working mother, I always had, and still have, a big guilt complex about being away from home. My evenings were spent ferrying my children to training sessions and on the sideline at matches and catching up at home. I really didn't have time to feel unwell. My husband was concerned, however, about my health in general, fatigue, headaches, my colour. Yes, I was tired, but I wasn't sick. Then a close colleague at work commented on my cough every morning. I would reply that this cough was caused by the exertion of climbing the 4 flights of stairs to the ward. Until one day I did become unwell at work and presented to the medical assessment unit. I sat on a trolley, had my bloods checked, and was examined thoroughly. I remember being given the results of a CAT scan later that day, and this was normal, and there was such a feeling of relief. So one last test, a cardiac echo, I remember the consultant saying that Friday evening. As the technician performed the scan, I knew instantly there was something wrong. This was taking far too long. I was told I would be reviewed by a cardiologist on the Monday. No other answers were given, and this seemed like such a long time away. Nothing prepared me for my diagnosis. The following week, more tests, invasive tests, were performed, and subconsciously I kept thinking, it won't be as bad as they think. I was in denial. I was so afraid of what I was going to hear. But by the following Friday, when the consultant sat by my trolley and told me I had a congenital heart defect requiring open heart surgery that couldn't be performed in Galway, I was speechless, no longer safe. I now realise the importance for patients of having somebody with them when receiving bad news. The cardiologist had already spoken with the surgeon in Dublin, and he would see me the following week. I was shocked, to say the least. Here I was in the angio lab, where I had often accompanied patients, pre and post procedures, some receiving positive news, others with poor outcomes. I was now no longer the nurse standing by the trolley. I was the patient lying on it. I sat and waited for my husband to collect me that day, and I will always remember the kindness and empathy shown. The nurse and the consultant, they were not intrusive, but they were present, observing and acknowledging my newfound predicament. Illness or any other diagnosis has a rippling effect for the patient and their loved ones. I waited till we reached the car and told my husband our news. As he comprehended the news just delivered, I was afraid, but had a desire to stay strong to protect my loved ones, my husband and my children, then aged 16, 14 and 10. Our mothers are our first nurses, and I had great empathy for my mother, who felt an uncontrollable guilt that maybe she had missed something in my childhood that may have been of some relevance to my diagnosis. My sisters and their families, close friends, they were all stuck for words. I consciously thought of all the patients I had cared for down through the years, sometimes not having given any great thought to those affected by their illness or who they had left behind when they presented hospital. As healthcare professionals, we admit patients to the ward or we receive their care from other areas. We are so focused on our own tasks, the here and now, and how safe do they feel? The days passed and I attended my appointment with the cardiothoracic surgeon, and I remember him asking me what I had been told by the cardiologist. I muttered out a few sentences and afterwards reflected on several occasions what exactly did I say to him. As he sat and explained the risks of surgery to my husband, thoughts floated in my head. This wasn't happening. As a patient, we're given all this information regarding the diagnosis. We then need to assimilate the information. However, these two stages don't always happen together. I returned home that day, everybody, especially my children, waiting in anticipation for news. We had decided that we would inform them from the start of my care plan. My teenagers wanted the truth, and honestly, I felt they coped better with my illness and complications which followed later as a result of this decision. Approximately 3 weeks later, after delayed admission due to infection, I was admitted to hospital. At this stage, I was relieved, and I can clearly identify with the anxiety patients suffer, waiting firstly on a date for surgery and then the availability of a bed. Arrangements are made for work, for home, for children, partners take time off and then told, sorry, no bed today. As I left home early that morning to go to hospital, I had to return to my house. Moments earlier, I had walked out the door, and now, on my return, I found my 14-year-old daughter inconsolable. I held back my own tears, reassuring her, as best I could, things would be okay. And I returned to the car and cried for the first 20 minutes of the journey. Inconsolable, I wasn't going to be at home to support my children, physically and emotionally, through this ordeal, and secretly heartbroken for them and so afraid of what lay ahead for me. I was greeted by a very pleasant nurse who introduced herself and put me at ease straight away. The next few hours were taken up with admission and pre-operative checks. My theatre time was scheduled for 12 midday the following day, and as my husband arrived to the ward at 10 a.m, so did the hospital porter to bring me to theatre. There had been a change of plan. As we sat and said our goodbyes, I became emotional, as did my husband. We were 19 years married that day. The nurse looking after my care that morning was very intuitive, recognising the situation, reassuring us, advising us to take a few minutes, and left us in the room for a brief time together. The nurse was caring for me, but more importantly, caring about me. As I drowsily woke up in the intensive care unit the next morning, I can clearly picture the clock on the wall, 5:15 a.m. I observed as the nurses at the bed spaces opposite attended to their patients. It was, after all, their busy time. My nurse approached. My eyes were open. However, there was no communication, no good morning or no smile. I could hear her tear open packaging behind me. A suction catheter appeared, and I panicked. Did I have a tracheostomy? Not realising I was still intubated. She told me to open wide. My endotracheal tube was going to be removed. No kind words of reassurance, no one holding my hand. There was a split second of terror. Extubated. I had survived the ordeal. Did I feel safe? No. And I can only imagine how traumatic this would be for a patient with no clinical experience. Okay, I appreciate the nurse had been up all night. The area was very busy. She was very efficient, but not very caring. I remember my first walk with the physiotherapist, getting out of bed, strong desire to get better, but feeling very restricted and feeling unsafe. I now definitely was the patient. However, the nurse instinct never left. I was to stay strong. I felt I needed to push myself. I didn't want to be labelled as non-compliant, difficult, or worse still, your typical nurse. That first short walk with my urinary catheter and chest drain on tow rejuggled my thoughts back to my own ward. Being on duty in the mornings, conscious there was 7 patients who required full assistance, I was never going to rush anybody again. I was now so aware of the importance of being gentle, encouraging, and working with the patient. So often as healthcare workers, we are overwhelmed with our own tasks on a particular day. There may be staff shortages due to sick leave, meetings to attend, audits, site visits, the list is endless. But from my own experience of having been a patient, those 2 extra minutes when we allow ourselves as healthcare workers to stay in that moment with the patient, when they need to sit on the side of the bed, take a sip of water, tell you about their grandchild or a situation they find themselves in, is so critical to their care and safety. Night 2 post-op, I was very uncomfortable, experiencing pain. I rang the call bell and asked the healthcare assistant if it was possible to get another pillow. Now, from my walk in the corridor that day with the physiotherapist, I had identified the linen cupboard at the other end of the ward. The healthcare assistant left the room and returned within a minute, informing me there was no pillows. There was no way she'd been to the end of the corridor. When she left the room, I faced the arduous task of sitting up unaided, shuffling to the end of the bed, conscious of all my attachments, reaching for my dressing gown and rolling it up to place under my head. It wasn't great, but it was better than nothing. Some might say it was only a pillow, but with existing discomfort and broken sleep, it would have been a huge comfort to me. I was annoyed that the staff member hadn't looked up or approached anybody to find a pillow. My chest drain was removed next day. It was coming up to lunchtime. It was Saturday and there was minimal staff on. 2 nurses entered the room and I was asked by the senior nurse if I would allow her junior colleague, a very shy girl, to remove my chest drain under supervision. I didn't hesitate. I'd once been a junior staff member and now was acknowledging the need for all staff to be competent and willingly return to my bed. As I lay flat on the bed, the senior nurse instructed her colleague as she performed the procedure and at the same time instructed me when to breathe in and out. She shouted at her junior colleague to get on with it. Conscious of the time, the nurse fumbled, and as she removed the drain, I was concerned for my safety, but felt empathy for the nurse removing the drain. Again, as healthcare professionals, we're not always very kind to each other. We need to support each other, but also to consider the patient when supporting and supervising. We need to alleviate any fears the patient may have if they're concerned about our competencies. Day 5 post-op, I was allowed to have a shower. Unknowingly, this was going to be an ordeal unaided. This was a great physical challenge, and as a nurse, we consider it a routine task to patients' care needs. Not such a simple task unaided, I cannot emphasise enough. Because of my chest wound, it was very difficult to carry any items, so I made several trips to the bathroom to transfer clothing and toiletries. It was such a relief washing myself. Prior to this, only wipes had been provided, and I was convinced there was a smell in the room. I sat in the shower almost overcome by steam, hoping I would reach the call bell if I became weak. Nobody offered assistance or support or advised that they were only a call away. Now, nurses presumed this 40-year-old was well able to look after herself, and I was, but the offer to call if I needed anything would have been very grateful. I returned home on day 5 feeling sore and sorry for myself, but I was getting better. Almost 5 weeks post-surgery, my wound had not fully healed. I became unwell and required admission. Little did I know at this time my surgery had been a walk in the park, and the most difficult and stressful period of my life so far was now facing me. I was diagnosed with infection which would require a minimum of 6 weeks of intravenous antibiotic therapy. A PICC line was placed in my arm and I was allowed home on treatment. My antibiotics continued for 6 weeks with twice weekly clinics for bloods, and this had its own stresses with parking and sometimes long waits. 2 days off my antibiotics, wound was healed, I was readmitted with pneumonia, and as I lay on a trolley awaiting a bed, I was feeling frustrated and upset. I was overcome with fear. Here I was, lying in the hospital where I had worked for 22 years. I had no control. My next admission rolled in soon again, and after a brief stint at home, this would be my longest yet, 40 days. As a patient, you're very aware of your surroundings. You become familiar with hospital routines, noises, and voices. Yet when I lay in bed at night, I was overcome with the concern. Was I ever going to get better and be able to return to work? I was never going to give out about work again. I remember hearing the emergency bell go off in the middle of the night. My instinct was to run, but I was now a patient, not the nurse. My condition did deteriorate, and I became extremely breathless and uncomfortable due to pain. The ward cleaner entered my room, and seeing I was breathless and upset, acknowledged it, offering me reassurance and help. I knew I was not alone, which gave me great comfort. I was assessed that afternoon by the physiotherapist, whom I had often assisted with patients on the ward. He was accustomed to my normal pace, my routine and working day prior to my illness. I could feel and see his concern as I attempted to walk the corridor, deconditioned and requiring assistance. He took the time to sit with me and listen to my concerns. He then left the room to contact the medical team. I felt supported and safe. There were several days as a patient I often wondered, did anybody really know what was wrong with me? It appeared to me there were very few diagnostic tests left to perform. Bloods had been taken daily, x-rays repeated. Where were the answers? As my condition was complicated, I had intervention from several different consultants in my care. My primary consultant who looked after my care was very attentive and always listened. I felt she respected my opinion. I admire her honesty now, but this wasn't always appreciated by me when unwell. There was uncertainty. She didn't have all the answers, but I was offered reassurance as she involved other disciplines in my care. And as a patient or family member, we want the quick fix. We want all the answers and we want treatment. but this isn't always available and may not work in our favour. On the night I became acutely unwell, and as a nurse I understand how I needed to be assessed by anaesthetics before admission to intensive care. My husband had left a couple of hours earlier and all seemed very well at the time. My nursing colleagues attended to me and I informed them through my gasping breaths I would ring my husband to update him of my condition and to advise him to return to the hospital. I knew I was in trouble. I did this for 2 reasons. I felt I had some control of this newfound situation, but more importantly to support my colleagues. As a nurse, I know how difficult it is to ring a relative or a friend or of a patient to inform them of a patient's decline. I understand the importance of the language used, the way it's delivered to the patient's loved ones, their reaction, their interpretation, the panic, sometimes tears and silence that follows, the support we offer to them, reassurance where possible, or sometimes just a listening ear. I felt a great sadness for my caregivers that morning, especially the nurse who transferred me to intensive care. Those staff present on the ward, some I had worked with a short time, others over several years. I shared life's events with them. I trusted them and believed they would assist and support me. I know the feeling of helplessness when the care required by a patient cannot be achieved at ward level, and I know the relief when a patient is transferred to critical care and will be supported with primary care. You might say this was given to me because I was a nurse, but I've witnessed my many colleagues down through the years in nursing who are true advocates for their patient safety. My stay in ICU was short and I received excellent care. When in an open area, it is impossible not to overhear conversations. Patients are not listening intentionally. The patient in the next bed space was a young lady with special needs. She was experiencing respiratory difficulties and was supported with non-invasive ventilation. Her condition did deteriorate, and after her mother received the devastating news, one by one her siblings and family members arrived to the unit. This lady was their life. We can learn so much from observing their quick steps to the bedside, fear written all over their faces, words of kindness to the patient, and the silent tears flowing down their faces as they sat or walked away from her bed space. The nurse and multidisciplinary teams being present, attending to the patient, but allowing the critical time for the family to be with their loved ones. As a nurse, I could identify the staff merging their tasks with the human components of compassion and safe care. As I lay down to sleep that night, I wondered what the next day would bring for this family. I awoke to hear the TV on in the patient's bed space. The nurse was removing her CPAP machine, applying an oxygen mask, and communicating with the patient, and explaining with great reassurance what was happening as she was supported by her mother. The advert for Galaxy chocolate came on the screen, and with short, laboured breaths, this young lady attempted to sing the words of Moon River. There was a glimmer of hope for us all that day. I eventually got home to the mayhem of my children returning to school. Afterwards, there were several hospital appointments, weekly blood tests at the clinic, a relapse requiring another 10 days in hospital, and numerous other experiences I could talk about today. Reflecting on my time as a patient, I now know the feeling of shock and helplessness when you're given bad news. I now understand the frustration of feeling so unwell and waiting on a trolley for a bed. I know what it's like to ring a call bell, feeling I was a burden. The bell was always answered, but this didn't lessen my anxiety. I know the feeling of vulnerability while lying in a bed at night on a ward, wondering, will I ever get better and be able to return home? I know the feeling of embarrassment when you're labelled an infected case. I can still feel the despair of when a cannula dislodges or infiltrates. This was the most thing I dreaded, as I had very poor venous access, and I pitied people who had to actually try and cannulate me because I knew it was going to be a nightmare for them. But without it, I knew I wasn't going to survive. So having had 2 PICC lines and several central lines placed, I know the humiliation of having to ask a staff member to clean their hands or to use sterile gloves. I know how it feels to put on a show when your child comes to the ward to visit you, watching their scared expression as they witness you struggle to get up from the chair. I know the feeling of safety having been cared for by staff, showing compassionate and safe care. From my own experience, it is more difficult to be a patient than to be a nurse. When a patient comes to hospital, they place their trust in somebody they've never met before. I appreciate the difficulties staff encounter on a daily basis. I've been there too. But let me reiterate that a smile, a handshake, A simple introduction can put a patient at ease from the moment they arrive. Our interaction with patients allows us to deliver care in so many ways. At their bedside, we can create a safe space, a place for trusting and safe care, allowing them to feel supported, listened to, and promoting their health and well-being. And I would like to finish with a quote from Helen Keller: "Alone we can do so little, together we can do so much." Thank you very much.